Americans live in a culture of stress. Mass shootings, domestic violence, sexual predation, and drug addiction dominate our media. There's violence on our streets, in our schools and homes, in our neighborhoods. Our children fail to reach their potential, and even with the most advanced medical technology in history, many Americans fail to meet their life expectancies. In Michigan alone, according to the Citizens Research Council, nearly $70 billion a year is spent on healthcare with no end in sight. Costs driven by chronic disease, addictive behavior, and the high price of ineffective patient and pharmaceutical interventions have driven our healthcare system to the brink of failure and compromised the potential for future generations. But what if we could find a way to vastly improve the quality of life for countless children and adults and dramatically reduce 7 out of 10 of the leading causes of death at the same time? What if we could seriously diminish the likelihood of debilitating disease across the majority of our population by taking action before any damage occurs?
In 1995, the Centers for Disease Control, in partnership with Kaiser Permanente, came together to do a study of over 17,000 patients. The study was led by Dr. Robert Anda and Dr. Vincent Folletti, and they were studying what adverse childhood events and exposures to these events early in life, how they might correlate to health outcomes as an adult. The findings were really quite provocative. They found that, indeed, exposure to adverse events in childhood had effects on a number of health metrics, things like pulmonary disease, heart disease, diabetes, depression, addiction, even cancer. Those who had experienced this exposure and developed a higher risk of these health outcomes were not necessarily those who had developed at-risk behaviors. The experience was really for everyone.
Adverse childhood experiences are not scoring poorly on a test or not doing well in a baseball game or not having a good relationship with a friend. They're much deeper than that. These are very serious experiences that children have. Things like sexual or emotional abuse, substance abuse in the home, severe poverty, loss of a family member, an adult, incarceration. When they have these adverse childhood experiences, the science tells us that if there's not an adult that helps them through the coping, there's some pretty serious consequences. The dose-response relationship basically says that when these events accumulate and pile up and get added onto each other, the impact gets greater and greater and greater. And so children who have an adverse childhood experience score of 4 or more, all the way up to 10, then have some prediction of the probability that they're going to have difficulty later on in life as adults.
So the original ACEs study, the findings really were groundbreaking in that it showed us very concretely that adverse childhood experiences and what happens to someone as a child directly correlates to their health later in life. What Dr. Jack Shonkoff from Harvard showed us in the subsequent study is that their brain chemistry has changed, that their DNA is affected, that their immunoresponse is affected. And so we understand now the cause and effect, and we also understand why those adverse childhood experiences manifested themselves in higher disease rates.
The body has actually an amazing stress response system that's both biologically and psychologically grounded. It helps us get the adrenaline out and run. It's the fight and flight, the immediate response. But that only gets us a couple minutes of energy to get us going. Now we need another system that would maintain that. And that's our system that's called the Hypothalamic-Pituitary-Adrenal stress axis. And that produces the stress hormone cortisol. It lasts for up to an hour or more. If cortisol is chronically elevated, this is not a healthy thing. It's good for the bear or for the lion that might attack us in the moment. But if this is chronically elevated, it's really detrimental because it shuts down systems that are important for healthy living.
When we're confronted with an emergency, the brain then sends signals to the pituitary gland, to the adrenal glands, and release of hormones and chemicals change the way your body and your brain functions in that instant that enhances your ability to respond to that situation. When the emergency response system is activated over and over again, the ability of the brain to return to its normal functioning becomes lost. In developing kids, it suppresses the frontal cortex. Critical thinking and executive function and memory are all obviously important to learning, and if those are being suppressed or impaired on a regular basis, then you're basically learning impaired.
This is what toxic stress is. Those same hormones that help us survive danger in large doses can create architectural deficiencies in all areas of the brain, causing a weaker foundation for critical thinking that leaves us vulnerable to chronic disease later in life.
What the ACE study tells us is that there are lasting ramifications to these adverse experiences that happen in childhood, and they're long-lasting. And if we can address those early during childhood and help reduce or mitigate the effects of ACEs, then we can avoid having those poor health outcomes or those long-lasting negative outcomes. Here in Michigan, 70% of adults report having one or more ACEs. And dramatically, 20% of adults have 4 or more ACEs. And what we know about the dose response is the higher the ACE score, the poorer the health outcome. People die 20 years sooner when they have 6 or more ACEs.
So the human impact of high ACE scores is dramatic, but equally dramatic are the economic costs. We're seeing about half the cost of all physical health care that's related to chronic conditions is a result of high ACE scores. And that's true for mental health as well. About half the depression-related healthcare costs related to people with high ACE scores. Some of the research on addictions is new, but ACE scores account for even a greater share of addiction-related needs than physical healthcare needs. It's almost 60%. The best estimates are it's about 1/3 of all healthcare costs are related to people with high ACE scores. That's about $30 billion a year in Michigan. I think a lot of us are staggering under the cost of healthcare. This is one of the causes.
People like to put a number on costs and like to be able to talk about specifically what the impacts of these issues are. I've seen that number from the CDC and, $200,000 per child, but that's mostly related to productivity costs. These children become unproductive adults that then pass on their adverse childhood experiences to the next generation and to their children. Unaddressed, this issue is going to continue and is going to continue to be a significant problem for our public systems and for our society in general. And what's important to understand is this is not a social worker's problem. This is not a psychiatrist's problem. This is not a teacher's problem or a pediatrician's problem, or it's not even a juvenile court judge or juvenile court referee's problem. This is everyone's problem. But then also, really what's exciting is the studies are starting to show that we can change that and that we can mitigate these things by addressing these issues.
We were fortunate enough to work with the Michigan Health Endowment Fund to create what we now know as the Michigan ACE Initiative. The core objectives are pretty simple. First, it's awareness, both at the community and state level. Second, it's dealing with the provider community, either through continuing education, some policy issues to increase screening and their involvement so we can identify kids early, break the cycle. Third is overall public policy, working with the legislature and the administration in terms of programs. And the fourth is to kind of make sure we don't lose and step backwards, and that's preserve the safety net. We think that's critical. That's kind of our strategy now. Let's build that grassroots. Let's work with the provider community, and let's create that policy template with the legislature and the administration.
It really should be a change in the way that we look at things. And, if we take it beyond just the words, it is a cultural shift, because many times we have a culture where we will say things like, it's a bad kid or they had bad parents and those kinds of things. But the ACEs really causes us to dig a little bit deeper. The cultural shift is really based on a change from what's wrong with you to what happened to you. And that really changes the whole dynamic, because now we know that the ACEs really do impact people over the long term. But it's not just enough to know. Then we have to move that to how do we help people to identify those protective factors and really dig deep and find the resilience within. There are many people who can make a difference as it relates to resilience, but really we need to look at it from the standpoint of the grassroots and go back and think of all of the people who really touch the lives of children and families.
If you think about toxic stress as kind of the bad guy in this, then I think resilience can be considered the hero. And quite simply, the idea of resilience is just the ability when you face toxic situations, when you face adversity, that you have that ability to kind of work through it. It's not an innate thing. It's not something that people are born with it necessarily. It's something that people can learn. When kids are in a circumstance where they're nurtured, when they're in a consistent environment, when they get the kind of feedback and support that they needed, then that's what builds resiliency. More broadly, let's think about ways where our organizations and our service providers can work together and really make those efforts at the community level where volunteers can be that consistent adult in a child's life where when things are getting tough, they know they've got somebody that they can go to.
Central to the success of building healing, resilient communities is the training, development, and deployment of ACE Master Trainers.
What we're hoping to accomplish with Master Trainers is to create that understanding and a platform for sending the message of trauma-informed culture, to understand how trauma impacts children and families, to also create an understanding for intergenerational transmission of trauma, this research and the data that supports this initiative and this shift. We are definitely the first wave for the Michigan ACE initiative. We identify leaders, we create awareness, we bring education to various systems. We also identify future trainers. So I believe that we really lay those foundational components that allow for us to create self-healing communities.
Michigan is a diverse state with communities ranging from small rural towns to urban giants. But ACEs know no boundaries.
Well, I think it's important to make people understand that ACEs are everywhere, that urban communities and rural communities and wealthy communities are similarly affected by ACEs. Rural communities are not just like suburban communities and urban communities for a number of different reasons. We're not going to be talking to thousands of people at a time. We're going to be having small conversations at schools, in health centers, with community service organizations, et cetera. Our audiences will be smaller, our discussions will probably be more intimate, and I think that in itself has value. They provide the same opportunity wherever they might be for building healing communities.
So in terms of creating a healing society or healing community in the Flint area, we know that we have to take a broad, comprehensive approach. Not only are the children impacted, but their parents are impacted and their grandparents. So actually there's a generational impact that we see when communities have historically had, decades and decades of challenges. Flint's a good example of how the power of the ACE study can be used because there's no such thing as a quick fix for Flint. And I often hearken back to a quote by Einstein that says, "The problems that we face today cannot be solved with the same level of thinking that we were at when the problem was created." So that means that we have to really think in a very innovative way, in a very comprehensive way, and invest in Flint, not just for the short term, but for the long term.
If creating resilience and healing communities is the goal, then identifying those in need is critical to success.
I think the most important piece that still needs to be implemented is that we need to be doing screening on a regular basis within the pediatric setting. I think the EPSDT process would probably be the most logical way of going at it initially, and then once that has been implemented, then we need to screen not just the children, but we need to screen the parents and potentially even the grandparents. And we need to figure out how to make that happen. There are systems of care that are easily adapted that would make it possible for everybody to get training on how to do this and to do it and feel good about doing it.
I think it's absolutely not only critical, but fundamental that lawmakers and the administration take a very clear, unmistakable position on adverse childhood experience. There's opportunity. This creates a path forward for us to deal with healthcare in a way we've never had before. And what we think ultimately is not to create new programs, but really to do what you're doing and look at it through the lens of whether or not it's moving the needle on adverse childhood experience. And if it's a positive, then your program's good. If it's a negative, then we need to do something within that program. But we need to build a sustainable effort, and that requires policy efforts with the state.
I think the Michigan Initiative is really the first program that I've seen in training hundreds of people to be able to go out and teach the basic science of ACEs, including how ACEs influence brain development and the way our genome works, and talking about resilience so that the entire state will reach a critical mass of understanding of the science. That's the foundational beginning for population level change in the health of the public in the state of Michigan. And I think Michigan will be an example for other states because of the scope of what they're doing, the number of people they're training to teach this, and the strategic planning behind it, working with people who are in the different service organizations, legislators, policymakers, people from nonprofits, voluntary agencies, really a diverse group of professional people to go out and teach this and to embed it in the general public, as well as all of the human service systems simultaneously. Part of my hope of the Michigan Initiative is that many good things will come out of this, and people will look across state lines and say, if Michigan did it, we can do it too, and it'll create a cascade of events across the country.
People need to get involved. You don't need a degree, you just gotta care. You gotta be able to see, you gotta be able to identify those individuals and then ask the question, what can I do to help to support them? And that allows opportunities for everyone, whether or not you're just the average Joe off the street or you're the pastor or you're, an administrator or a school teacher or whatever, there's always opportunities for everyone to get involved. And what you can do is just start to talk about it, generating that interest, having discussions in your community, and continuously allowing people to be aware and then to encourage people to learn, and then you sort of take it from there. But we start with the individuals, and then it leads to the homes, and the homes to the communities, and communities to the state and to the nation. So that's what we have to build upon, but just show an interest, be able to get involved any way possible.
Michigan ACE Initiative fits beautifully with our mission because we are mainly interested in prevention and early intervention, keeping children and older adults out of the health system or hospitals through healthy lifestyles. And by identifying early on adverse childhood experiences, toxic stress, and doing something about that, will save not only dollars down the road in healthcare costs, but enhance the quality of life for Michigan people. The Michigan Health Endowment Fund is very pleased to be able to support the Michigan ACE Initiative, and we're encouraging partners to get involved and support it too.
If you are an individual or a community leader looking to get involved, please follow the links on your screen to get the information and the help you need to get started.